8 warning signs of colon cancer you shouldn't ignore. Imagine a silent killer lurking in your gut, quietly growing until it's too late. That's colon cancer. But did you know that it's also one of the most preventable types of cancer? While colon cancer often starts with no symptoms, it can cause significant issues as it progresses. Let's explore how it affects your body and why early detection is crucial. 1. Abdominal pain and cramping. Abdominal pain and cramping are common symptoms of colon cancer, though they can also be caused by many other conditions. This pain might feel like a constant ache or cramp in your stomach area and can vary in intensity from mild to severe. Colon cancer-related abdominal pain and cramping typically occur as the tumor grows and starts to block or narrow the intestine. This blockage can cause a backup of stool and gas, leading to discomfort and pain. Sometimes the pain can be accompanied by bloating or a feeling of fullness even after eating small amounts. It's important to note that abdominal pain and cramping can be caused by various factors other than colon cancer, such as gas, indigestion, or constipation. However, if you experience persistent or severe abdominal pain, especially along with other symptoms like changes in bowel habits or unexplained weight loss, it's essential to see your doctor. Your doctor can perform tests to determine the cause of your symptoms, such as imaging studies like CT scans or colonoscopy. Detecting colon cancer early can improve treatment outcomes, so it's crucial not to ignore persistent abdominal pain or cramping. If you're concerned about your symptoms, don't hesitate to seek medical advice. 2. Blood in the stool. Blood in the stool can look different. It might be bright red and cover the stool or mix with it, or it can be dark and sticky, which might mean bleeding is happening higher up in the digestive system. Bleeding from colon cancer can come and go, and sometimes you can't see it with your eyes. In some cases, there might be blood in the stool that you can't see, but it can be found with tests. Not all colon cancers cause bleeding, and just because you don't see blood doesn't mean you don't have colon cancer. If you see blood in your stool or on the toilet paper, it's important to talk to your doctor. They can do tests like a colonoscopy to find out what's causing the bleeding and suggest the right treatment. Don't ignore bleeding from your rectum or think it's not serious. Finding colon cancer early and getting treatment can help you get better. If you notice bleeding or other worrying signs, it's important to see a doctor. Your health and well-being are worth prioritizing. 3. Unexplained weight loss. Unexplained weight loss refers to a significant decrease in body weight without any intentional effort, such as changes in diet or exercise routines. While losing weight may seem like a positive outcome for many people, unexplained weight loss can be a warning sign of an underlying health issue, including colon cancer. In the case of colon cancer, unexplained weight loss often occurs as the tumor grows and affects the digestive system's functioning. The cancerous growth may impair the body's ability to absorb nutrients from food properly, leading to weight loss. Additionally, the body may also break down muscle tissue and fat stores to provide energy, further contributing to weight loss. It's essential to pay attention to unexplained weight loss, especially if it's significant or occurs rapidly. Losing more than 5% of your body weight within a few months without trying could indicate a problem that requires medical attention. However, unexplained weight loss can have various causes besides colon cancer, such as thyroid disorders, diabetes, or depression. Therefore, it's crucial to consult a healthcare professional if you experience unexplained weight loss to determine the underlying cause and receive appropriate treatment. Your doctor may perform a thorough physical examination, review your medical history, and order diagnostic tests such as blood tests or imaging studies to identify the reason for your weight loss. Detecting colon cancer early can improve treatment outcomes, so it's essential not to ignore unexplained weight loss or other concerning symptoms. 4. Fatigue and weakness. Fatigue and weakness often develop as the cancer progresses and affects the body's overall functioning. The tumor can disrupt normal bodily processes, leading to fatigue and weakness. Additionally, as the cancer grows, it may cause internal bleeding, resulting in anemia, a condition characterized by a low red blood cell count. Anemia reduces the blood's ability to carry oxygen to tissues and organs, leading to fatigue and weakness. Furthermore, the body's immune system may mount a response to the cancer cells, which can consume significant amounts of energy and result in fatigue. Plus, the emotional and psychological toll of dealing with a cancer diagnosis and treatment can also contribute to feelings of fatigue and weakness. It's important to pay attention to persistent fatigue and weakness, especially if they interfere with your daily activities and don't improve with rest. While fatigue and weakness can have various causes besides colon cancer, including sleep disturbances, stress, or certain medications, they shouldn't be ignored, particularly if accompanied by other symptoms. If you experience ongoing fatigue and weakness, it's essential to consult your healthcare provider. They can evaluate your symptoms, perform necessary tests such as blood tests to check for anemia or imaging studies to assess for cancer, and recommend appropriate treatment. By addressing the underlying cause of fatigue and weakness, whether it's colon cancer or another condition, you can take steps to improve your overall well-being and quality of life. 5. Iron deficiency anemia. In cases of colon cancer, the tumor or growth in the colon or rectum may bleed slowly over time, leading to chronic blood loss. This ongoing loss of blood can result in a gradual decrease in iron levels in the body, eventually leading to iron deficiency anemia. The blood loss may not always be visible, as the bleeding can occur in small amounts over an extended period, resulting in subtle symptoms that are easily overlooked. Symptoms of iron deficiency anemia can include fatigue, weakness, pale skin, shortness of breath, dizziness, and cold hands and feet. These symptoms occur because the body's cells and tissues aren't receiving an adequate oxygen supply due to the decreased number of red blood cells. It's important to note that iron deficiency anemia can develop slowly over time, and symptoms may be nonspecific or attributed to other causes. However, if left untreated, iron deficiency anemia can lead to serious complications and negatively impact overall health and quality of life. If you experience symptoms of iron deficiency anemia, especially in conjunction with other signs of colon cancer, it's essential to consult with your healthcare provider for further evaluation. Diagnostic tests such as blood tests to measure iron levels and a complete blood count, CBC, to assess red blood cell counts can help confirm the presence of anemia and determine its underlying cause. Additionally, if iron deficiency anemia is suspected to be related to colon cancer, further evaluation with imaging studies such as a colonoscopy or imaging of the gastrointestinal tract may be recommended. These tests allow healthcare providers to visualize the inside of the colon and rectum and identify any abnormalities, such as tumors or polyps, that may be causing bleeding and contributing to iron deficiency anemia. 6. Changes in bowel habits. A persistent change in bowel habits that lasts for more than a few days should not be ignored, especially if there is no obvious cause, such as dietary changes or medication. It's essential to pay attention to changes such as increased frequency of bowel movements, persistent constipation, or stools that are narrower than usual, as these can be early warning signs of colon cancer. Additionally, if you experience abdominal discomfort or pain along with changes in bowel habits, it's important to seek medical attention promptly. Colon cancer is highly treatable when detected early, but it can be more challenging to treat if it has advanced to later stages. Therefore, being vigilant about changes in bowel habits and discussing them with your healthcare provider is key to ensuring timely diagnosis and appropriate management of colon cancer. Don't hesitate to speak up if you notice any changes in your bowel habits, as early intervention can save lives. 7. Nausea and vomiting. In the context of colon cancer, nausea and vomiting may occur as a result of various factors related to the disease and its effects on the body. For example, as a tumor grows in the colon or rectum, it can obstruct the normal flow of digestive contents, leading to bowel obstruction. This obstruction can cause a buildup of food, fluids, and gas in the intestines, resulting in symptoms such as abdominal discomfort, bloating, and nausea. In some cases, nausea and vomiting associated with colon cancer may be triggered by other factors, such as chemotherapy or radiation therapy used to treat the disease. These treatments can cause gastrointestinal side effects, including nausea and vomiting, as they affect healthy cells in the digestive tract. Seeking prompt medical attention is crucial for determining the underlying cause of nausea and vomiting and ensuring appropriate management. Healthcare providers may perform diagnostic tests such as imaging studies or endoscopic procedures to evaluate the gastrointestinal tract and identify any abnormalities, such as tumors or obstructions, that may be causing symptoms. It's important to recognize that nausea and vomiting are not specific to colon cancer and can occur due to various other conditions. However, when these symptoms occur persistently, especially in combination with other signs of colon cancer, they should not be ignored. 8. Persistent rectal bleeding. Persistent rectal bleeding refers to the consistent passage of blood from the rectum, often observed in the stool or on toilet paper after bowel movements. While rectal bleeding can have various causes, including hemorrhoids or anal fissures, it can also be a sign of more serious conditions such as colon cancer. Colon cancer-related rectal bleeding typically occurs as a result of bleeding from a tumor in the colon or rectum. The blood may appear bright red, indicating fresh bleeding from the lower digestive tract, or it may appear darker if the bleeding is higher up in the digestive system. However, it's important to note that not all colon cancers cause rectal bleeding, and the absence of bleeding doesn't rule out the possibility of cancer. Persistent rectal bleeding should always be evaluated by a healthcare professional, as it may indicate an underlying health issue that requires prompt attention. While occasional rectal bleeding may not be cause for alarm, persistent bleeding or bleeding associated with other symptoms warrants investigation. In the context of colon cancer, persistent rectal bleeding may be accompanied by other symptoms, such as changes in bowel habits, abdominal pain, or unexplained weight loss. This combination of symptoms can be concerning and should prompt further evaluation. Early detection and treatment are key to improving outcomes and survival rates for colon cancer. If you notice any of these symptoms, it's essential to consult with a healthcare provider for appropriate testing and diagnosis. Prioritize your health and well-being by taking action when you notice something unusual.